So, Rishi Sunak launched a new healthcare scheme today that means millions of Brits waiting for a GP appointment will now be able to visit their pharmacy instead.
You're going to be able to get treatments for 7 common ailments from your pharmacist rather than have to visit your GP. That is going to free up millions of GP appointments and ensure that you and your family can get the care you need as quickly as possible.
OK, lovely backing music there. The illnesses included are a sore throat, earache, sinusitis, impetigo, shingles, infected insect bites and uncomplicated urinary tract infections in women. Now, currently, 1 in 6 English patients are forced to wait at least 2 weeks for a GP appointment. But the problems in the NHS persist when you actually do get seen by a medical professional. This pharmacy thing is a capitulation to the fact that we haven't got enough GPs and people can't get appointments, right? I don't think this is necessarily a good thing. And I think it could have been solved by telling people who are maybe a bit too thick that they should not be going to GPs for things like a little sore throat. But what about medical negligence? This is not spoken about enough when it comes to our NHS. The NHS forked out a staggering £2.7 billion settling medical negligence claims in 2022. That's across maternity care, emergency medicine, orthopaedic and general surgery. That is an absolutely astounding number. And some individual medical trusts as well, hospital trusts, forked out tens of millions of pounds on their own. So with that in mind, I am asking tonight, do you actually think that the NHS is safe for patients? Let me know your thoughts. Email me, gbviews@gbnews.com. Tweet me at GBNews. While you're there, go and vote in our poll. I'll bring you those results very, very shortly. Before we get to our debate, I do want some expert reaction to that initial pharmacy announcement, OK? I'm joined by Dr Layla Hambeck, CEO of the Association of Independent Multiple Pharmacies. Dr Hambeck, look, thank you very, very much. Let's just deal with that initial matter in hand, so this actual policy, right? Is this us fobbing off people at pharmacies? Could pharmacies actually miss things? Is it a good thing? Go on.
Well, Patrick, this has been going on in Scotland, for example. The Pharmacy First scheme has been going on in Scotland for many, many months. And the results have shown that patients actually quite like it because pharmacists have always delivered that accessibility and convenience. So it's just, popping up to your local pharmacy, who many people know already, and then having those conversations in a consultation room with that pharmacist. And they are, expert in medicines and expert in common ailments. So why not?
Are they qualified enough to say, you've got a cough or that might be lung cancer?
Oh, of course. So, and also it's very important that the public know that we are working based on some very strict rules in terms of making sure that we ask the relevant questions and give the relevant treatment based on, those rules. So it's not something that patients should be, or the public should be worried about because we've been there before. We've helped the NHS before, and this time we're stepping up to do that again.
Are pharmacists happy about this, or are they worried, some of them, about getting sued if they get something wrong?
Well, we've always been there in terms of telling the NHS that we want to be there to support. And, during the pandemic, we kept our doors open and we were one of the only places where people could go to when everywhere else were shut. So we've always been there helping the public. However, what has happened over the past few years is that our funding has been cut, and whilst everything else has been going up, energy costs and fuel costs and so on, our funding has been going down, and therefore many pharmacies are struggling to keep their heads above the water.
So this might actually help, I suppose, in that regard when it comes to getting more people through your door. All right, well, look, thank you very much. Reassuring stuff in terms of the actual quality of care people might get in a pharmacy. That's Dr Hambeck there, who is the CEO of the Association of Independent Multiple Pharmacies. So good stuff. I know a lot of people felt very, very self-conscious about wandering into a pharmacy, especially if you've got urinary tract infection or something. But what she says there is you're most likely to be seen in a private room, which maybe alleviates some of that. But that's the state of play in pharmacies. What about actual hospitals now? And I think people miss this, OK? As I mentioned earlier, medical negligence claims are being made at a staggering rate to the tune of billions of pounds. So do you think that the NHS is actually safe for patients? Going head-to-head on this, our social commentator and actress Jenny Barnett, up against broadcaster Paula London. Both of you, thank you very, very much. Paula, do you think the NHS is safe?
Not really. I mean, there's good doctors, there's bad doctors, but a late family member of mine was lied to in intensive care. He was told by a neurologist if he had a tracheotomy, he would never be able to eat again or speak again. And that was a complete lie. I pulled him up and then he apologised to me. He said that because he wanted my family member to come off a machine, basically, and lose their life. He ended up living a lot longer because I knew what the neurologist said was a lie. So, no, I don't think it's safe. And you really need to call out doctors. You need to be assertive and not believe everything they tell you. Many years ago, we didn't have Google, so we believed everything that a doctor says. Now you can research your symptoms, you can research the symptoms of your family member and ask the doctor questions. They don't like you using Google, but Google away is what I say. Knowledge is power. So I don't trust doctors 100% at all.
Jenny, £2.5 billion a year in medical negligence thing. You add that, or pick that apart, I should say, really. You look at numerous different maternity scandals. I mean, the absolutely staggering level of maternity scandals right across the country. I just wonder, seriously, all this window dressing about pharmacies and GP appointments and waiting lists, are we missing the key point here, which is that actually the NHS is not that safe for the people who need it?
Don't agree at all. I think the NHS is absolutely safe. I've spent it. Today I was in hospital. My old man's being treated for cancer, and I nearly lost my sight through something else. But the treatment that you get is remarkable. The one-on-one is remarkable. And care and safety is there. You have to look at the root cause. And what's going on is it has not been funded. Now we've become a litigious country where people are forever, ever trying to sue this and sue that as the American model. Back in 1945, the NHS was made for everybody, not just people who were affluent. Now we're in a situation, can't get your teeth done, can't get your eyes done. Nobody trusts this, nobody trusts that. And the root cause is a government that has not invested.
That's the argument that they make, because when the medical profession do mess up, they often blame it on systemic failures. So that can range from anything like, we didn't have enough equipment here. It can range to, I was so overworked and tired that a mistake was bound to happen and we missed this, etc. So there is litigation on both sides here, right? But, Paula, I can't help but feel as though at times there is a whopping great big culture of cover-up in the NHS, and they try and silence that with shed loads of cash.
100%. Even myself, I had a very bad sore throat once. I went to my GP. I said I've had strep throat before. I really need antibiotics. No, you don't need antibiotics, because your antibodies. 2 days later at home, I collapsed with strep throat and I had to be in the A&E for 3 days. Doctors need to listen to their patients, and a lot of them think that they are just God, and they don't like to be told they could be wrong. They seem to think they know it all, and I feel if more people did sue them, maybe they would try to do everything right more. I feel like they think that they can just get away with a lot, because they are getting away with a lot. A lot of people, when they lose their family members, they can sue when there's been negligence, but they decide not to because people will hate them because the NHS is so great, blah, blah, blah. They make mistakes and they need to, the NHS need to pay for it.
Look, Jenny, whenever I talk about topics like this, I always, chat about it with people in the office. I talk about it with just people generally. And I do put it to you that almost every single family in the country has got at least one NHS horror story.
Yeah,
and I think it pains me to say that the NHS is not being looked after. Junior doctors, nurses and consultants, they take the Hippocratic Oath. They take the oath where they want to make people better. They do not strike as an easy thing to do. And we're looking at an institution that has been brought to the ground because the Tory government have wanted people to go private. And it was happening years and years ago. The more you condemn what's going on, the more people get frightened, and then the more the NHS is on its knees. And I think it needs investment, and it needs love and humanity and compassion.
All right. I mean, OK. I mean, we're out of time. I mean, there is a heck of a lot of investment into the NHS, to be
never
perfectly
had
honest
so much money.
But for whom? It's to the bean counters. It's not going to the right place. It's going to management. It is not.
I get that. I do get that. But again, that is actually not just down to the government. That's down to the people who work in the NHS to make sure we sort that. Look, we obviously could bang on about this all night. We'll pick it up again, no doubt, at some point soon. Both of you, thank you very much. That is, of course, social commentator and actress Jenny Barnett and broadcaster Paula London. Both of you, that was great. Look, who do you agree with, OK? So, on Twitter, who's this? Cece. I'd be more likely to trust a pharmacist over a GP for meds if I needed them. Pharmacists know their stuff. The GP system is broken. Chris says, at my chemist, they are already really busy with lots of people waiting for their prescriptions. Don't know how the pharmacist will find time to chat to people about their ailments. Well, quite. Mary says, no, people with serious conditions are slipping through the net, being misdiagnosed or not getting timely treatment. It needs disbanding. It's not fit for purpose. Money isn't the issue. Mismanagement is. Look, your verdict is now in, OK? So 24% of you think the NHS is safe for patients. Wow, I was not expecting that. 24% of you think that the NHS is safe. So 76% of you think it's not safe for patients. There we go.